Dr. Chris Palmer is a medical doctor specializing in psychiatry at Harvard Medical School. He is the world expert in the relationship between metabolic disorders and psychiatric disorders. He treats a variety of different conditions, including psychosis, including schizophrenia, as well as attention deficit hyperactivity disorder, obsessive compulsive disorder, anxiety disorders, and depression, among others. For somebody who, let's say, is depressed, they've had some rounds of depression, maybe they're on antidepressants, maybe not, and they want to try something like this. Obviously, this has to be done in concert with a physician observing all this. But what is the typical thing that you probe with first? Just like with a drug, you might probe with 20 milligrams of a drug. What's your typical initial dietary intervention probe?
The first variable I'm going to look at when I recommend this or prescribe this is the person's current weight. If somebody's obese or versus somebody who's thin, I'm going to use different dietary strategies for those two situations. In the obese patient, they have tons of fat stores on their body already. Usually it is a goal of theirs to tap into some of those, and they'd like to lose some weight if they're going to try a ketogenic diet for brain health anyway. And so I'm going to use that. So that person, really, the diet is carbohydrate restriction, and that usually is a sufficient intervention.
Both simple carbohydrates, meaning sugars, and fructose also?
Fructose, definitely. So no added sugars, essentially. You can have added natural sweeteners like stevia or monk fruit. You might use artificial sweeteners. I'd probably, years after doing this, I'd probably recommend steer away from them if you can, because I think they tend to stimulate cravings for high-carb foods. Mm-hmm. So if you can kind of get through a couple of weeks without sweet things, your cravings for those will go down, and it'll make the diet easier and a little more sustainable. But let's say you can have your artificial sweeteners if that's what you really want. So I'm going to say less than 20 grams of carbs a day for those people. They can have all the protein they want. They can have vegetables, and they can have all the fat they want. But I'm not going to push fat on those people. I'm not going to tell them eat a lot of fat at the same time, because I want to use the fat on their body as the fat source, at least early on.
Are you encouraging healthy fats like monounsaturated fats like olive oil, or are you encouraging people to eat a little less butter, et cetera?
I tend to encourage, again, a wide range of fats, and it's going to depend on the person. A lot of times people come to me with very specific ideas, but I'm going to tend to encourage olive oil, avocados, nuts, which are usually considered, even by the American Heart Association, healthy sources of fat. The more controversial thing are things like coconut oil or coconut cream, which the American Heart Association might say is not a healthy fat. I kind of disagree with that and don't think it's unhealthy at all, actually. And when you look at the epidemiological studies of saturated fat causing heart disease or causing adverse outcomes, at best, maybe increases your risk 10 to 15% at best.
How much coconut oil can people ingest anyway before they either develop diarrhea, no joke,
yeah,
or just sort of get tired of coconut oil? But anyway, your point is taken. But they can eat meat if they like meat, or they could eat eggs, or if they don't like meat and eggs, they could eat sardines or things of that sort. I mean, I personally can't. I can't even stomach I don't even like the word sardine. I have nothing against the actual fish, but that's just me. But obviously, people have. I say this because people have different preferences, right?
Yes.
I'll eat a steak, but I'm not going to eat a sardine.
And I'm going to go with that. And again, there are vegan sources of protein that people can eat, tempeh and other things. So. That's the obese person. Carb restriction is the primary initial phase. The thin person is going to need to eat a lot of fat because they don't have a lot of fat stores on their body. And if I want them in ketosis, clinical ketosis, I'm going to have to feed them fat. So that's the person that I'm going to say, make sure you get in avocados, olive oil, butter, maybe a cream, heavy cream. So heavy cream is delicious. It's a delicious way to get your fats in. And have one patient who just drinks it straight to just try to get it in. Other people,
I get it. I've never had an appetite for sweets. I I absolutely love savory, fatty food. And when I was in high school, I was thin, so I was able to do this, but I used to drink half and half. Sometimes I wake up in the middle of the night and drink it just because it tastes so good.
It does taste good. So if they're on a ketogenic diet, I'm going to push them away from half and half and toward heavy whipping cream. And so you can whip that up, you can freeze it, it turns into ice cream, you can add vanilla, you can add cocoa powder, you can add all sorts of things, and you're off to the races with shakes and ice cream and mousse and all sorts of things that you can have. With any of these patients, the beauty of this diet is I have objective biomarkers. I'm going to have them measuring ketones, and I'm going to adjust the diet based on their state of ketosis and or the clinical benefits that I'm looking for. If it's an average person who is not currently under psychiatric care, not taking prescription medicines, but is saying, I'm burned out, I'm exhausted, I want some of that brain energy that Andrew Huberman's talking about. He talks about feeling good. I want some of that. I'm probably actually going to recommend the protocol you described, which is, let's see if we can just carb restrict for a while and see if that produces clinical benefit. I have one, he's not even a patient, just somebody who read my book. I didn't tell him anything. And he came away from it saying he was ready to start an antidepressant for his anxiety. He had chronic anxiety, was trying meditation, was trying all sorts of things. Nothing, those things weren't enough. He was ready to go on prescription medicine. He read an early copy of the book. He took it upon himself without consulting with me to restrict carbohydrates alone. He did not go ketogenic. He is a vegetarian. He restricted carbs. Within 3 weeks said, I don't need prescription medicine. I can't believe how much better I feel. And all I did was cut out some of the high carb foods in my diet. So I think for some people, it can be that simple. For people with serious mental disorders, if they are chronically depressed, if they're on lots of prescription meds, if they're disabled by their symptoms, and certainly if you're bipolar or have schizophrenia or something, those are the people I really do want them to work with a medical professional, because meds may need to be adjusted. They really need a real shot at this diet. It's not like weight loss. Weight loss, everybody wings it. And either you're successful or you aren't. You look on the internet or you read a book or you do, even the colleague that you mentioned, he's probably just reading. Who knows whether it's credible information or not, and just winging it and seeing whether it works or not. For people with serious mental disorders, I want you to treat it like you have epilepsy, because you do have a serious brain disorder. Like, it's impairing your ability to function in the world. It's impairing your health and happiness. You deserve a competent medical treatment. And we have that. We have 100-year evidence base. We've got dietitians who know this like the back of their hand. They can monitor your level of ketosis. They can help look for vitamin and nutrient deficiencies that can be a consequence of the diet and make sure that you're not developing those. They can help tweak the diet if needed. They can give you ideas if you're getting bored with eggs every morning. They can give you ideas for what else you might have. And, if you're using it to treat a serious disorder, I think you need serious help.